This is my purpose. I work with patients on a daily basis. I mean, this is why I got into this in the first place. I spent years working in corporate America while I was trying to treat patients and fight for legalization. And I started noticing these patterns, and I started being the go-to guy for recommendations. And now that I'm doing this full time, like it's not even work. It is my life's purpose to treat people. The genetics of the plant are cannabinoids. That's what the plant has as part of their DNA. What's expressed in the plant are terpenes, and terpenes are believed to be compounds that the plant created itself to fight off predators, insects. So, to give an example, uh, the original plants that were considered indicas that were grown in a northern climate, in Kashmir, Afghanistan, they were harsher. There was a lot of winds and there was cold weather, and these plants developed a really musky, skunky type of smell to ward off those predators. That isolated smell, that skunky smell, was associated with a terpene called myrcene or myrcene. And that is, if you isolate that, that is like when you have a Thanksgiving dinner, everybody eats a turkey, it's got tryptophan in it. Imagine that 3 to 5 times stronger than that. So it's, if you isolate that, it can put you to sleep. However, if you implement that with a full cannabinoid and terpene profile, your neurotransmitters that pass through the SIMPAS, that information allows that terpene to go into the part of your body like beta carophylline that's a natural anti-inflammatory. So what we're doing is we're doing two things. We're treating the pain, but we're also trying to heal the inflammation that's causing the pain. And the effect of the cannabinoids with the terpenes together, that's what they're used to do. So plant medicine is used in various different ways. It does have anti-cancer fighting effects. So humulene is a terpene that's associated with the actual tumor shrinking. We've experienced that in many patients. It can slow down the progression of Alzheimer's, Parkinson's disease. It can
Wow.
reduce seizures from epilepsy. And we've seen that in many different patients. However, once again, it's not a one size fits all. So Dravet syndrome, when you have 100 plus seizures a day, a certain CBD can actually increase the seizures that you have. So you have to be under doctor supervision, be really careful what type of plant medicine you take in your body. Also, it's worked phenomenally with nausea and pain from cancer patients caused by chemo. Also, AIDS and HIV treatment, and neuropathy. Any type of neuropathy pain, it's been really helpful with that. Fibromyalgia, PTSD, and brain injuries. I was just sitting on a panel with Athletes for Care, and they were talking about brain injuries and the amount of opioids and all these other things that they had to go through and the effects they had. And now they're making a shift to plant-based medicine, to utilizing cannabis in their lives. And it's not only is it reversing a lot of the effects of the brain injuries they suffered from, but it's also allowing them to enjoy their lives much better. And the quality of life is one of the most important side effects of using plant-based cannabis medicine. Earth Healthcare started about 18 months ago, and we've now moved into our next iteration. We have enough doctors that we can treat more patients. So we're scaling. We didn't realize the amount of people are going to be interested in this. We just thought that maybe we can treat just a lot of people that we know, and it just started growing from there. And we want to make sure we give everybody as much time, energy, and information as possible. Dr. Alan Lawrence, who's the medical director of Earth Healthcare, he's celebrated his 50th year in medicine this year, and he's a huge proponent of integrated medicine and mind-body connection. I think the biggest part of this is the healing. Your own personal healing comes back to you. You own it, you're part of it. And maybe this sounds hokey, but I believe in mindset. The patients that actually buy into the treatment, they buy into integrative medicine. Our bodies want to heal themselves. And if your mind knows and believes that it wants to heal and is part of the healing process, it tells our bodies to heal. And cannabis is just one part of that. It's not everything. It's one part of that. I don't want to say that it's a magic pill. Everybody take it. It's a cure-all. It's not. But it's an amazing, amazing medicine and is much more effective in different ways without the side effects than some of the other pharmaceutical medicines. But it's not a cure-all. Get your mind straight. Work on your body. Feed yourself correctly. Eat the right foods. Everything else together, that's what integrative medicine is. And now you have control over your own healing, over your own treatment. And that's kind of what Earth Healthcare and what I'm about. Regulations are an interesting thing. I am a fan of regulations as long as they're the right type of regulations. If we should treat this as any other medicine, you have to make sure that it's tested, it's got the proper labels on it, you know what the information is, and you can go to a lab, and the lab that is on this packaging is a trusted lab that has oversight by the state, the same way that we would treat any other medicine. There's two sides of the genetics. There's the plant genetics, and when I talk about really knowing what you put into your body, is number one, you want to understand what strain it is or what you're putting in your body as far as the genetics of the medicine. Number two, you want to put into your body something that's clean, microbial free, pesticide free, free of anything that's going to harm you in any way. If you're immunocompromised, especially cancer patients that are going through chemo, etc., you have to be really, really careful what it is that you're putting in your body. Everybody has their own individual experience with the plant. We can actually go a step further. So in Earth Healthcare, we can run a genetic panel. So somebody would actually use like a mouthwash kit, rinse their mouth out, spit it back in a tube, mail it in, and we would run a genetic panel. Based on genetic panel results, we could tell if you have specific variances in your genetic alleles. So to give you an example, if we run a genetic panel and there is a genetic variance in a gene called COMT, C-O-M-T. So that gene is associated with the production of serotonin, dopamine, and other chemicals. So if you have a genetic variance in that gene, usually it's a person is a little more depressed than usual. But the amount of the variance can determine bipolar, schizophrenia, clinical depression. So if I already know that you have a genetic variance in that one specific SNP of that gene, I know for a fact that you need something of a lift. So in my profile of a formulation that I'll create for you, I want to make sure that I stay away from things like myrcene that'll make you drowsy, and lift you with a limonene, which is a terpene that'll associated with serotonin production. I know for a fact, just by seeing that type of formulation is going to be more advantageous and have a much better effect to you than if I was giving you something to make you drowsy or make you down a little bit. Because we would do a genetic panel, we would then look at the root cause of the pain. Not every pain is created equally, right? So you have neuropathy pain, or you have just pain from inflammation, stress, everything else. So this would be a much more customized approach to treating your pain because it's the underlying condition that's causing that pain. So once we have functional panels, by the way, we're associated to a group of doctors. So we send you out to a lab, you get functional exam, blood work, everything else. We look at blood work, we look at genetics, and then based on that, we create a recommendation that is associated with your specific condition. So it's not just going out and saying, hey, you know, my buddy smoked some cannabis and his pain went away. Well, what's causing his pain may not be the same thing that's causing your pain.
Thank you. Yeah.
So we have to be able to know how to create medicine that's a lot more personalized, a lot more individual to you and what your needs are. And then, in addition to that, what your genetic variances are. So not only you're going to be in a bucket that based on neuropathy pain. So I already know what type of formulation works great for neuropathy. But if you have a specific genetic variance that's your own genetic variance, I still need to tweak that formulation so it can be much more aligned with your genetics and what your needs are. Our doctor visits are 1 hour usually.
Okay.
So the doctor then does a complete, so you upload your medical records and a doctor actually has a medical visit with you, talks about
Okay.
your medical history, everything else. So this is just like seeing your family physician. On a genetic kit, it's about 4 to 6 weeks to turn
Okay.
that around. So in the meantime, you'll have functional labs, and then we do have formulations that we can recommend, even if it's non-psychoactive formulations that have CBD until we get the test results back. But once we have the test results back, then we'll titrate your formulation, and that's more specific to you. But you'll receive treatment immediately, and we'll make certain recommendations based on data of other patients that we had right after your first visit. I'm a big believer that this is medicine for anybody who uses it. And the idea of seeing the doctor again and again to titrate, because we have to learn from the patient. We want to give the power of medicine back to the patient and take it away from the pharmaceuticals. So you're collaborating uh, in your own treatment. When we recommend a formulation, and then they see the doctor again in 30 days, and they say, "Hey, this is working," or this is giving me too much of a psychoactive effect or not enough. I'm used to it. Now we can titrate accordingly because it's a collaborative effort with a doctor. And that's an exceptional way to do medicine. It's the right way to do medicine because it's the way you want to work with the patient to get that feedback. Once we have that feedback, we also have a database that we're developing for the next person that comes in with a similar condition, and we can start dosing more appropriately based on that condition that we just experienced. So that's the kind of process to learn from your patients, to be able to create formulations that work, and to say to yourself, I'm learning. We don't have enough information. There's not enough data. So the more data we have, the more education we can create. Not everybody is the right candidate for cannabis. We have a lot of success in treating patients. Where we have less success is patients that are usually in hospice care, or patients that are stage 4, pretty critical. And the reason why we have limited success there is because of the opioids that they're on, where their doctor's not willing to make a shift. So these opioids, they bind to the endocannabinoid receptors. And what happens is it's like an on-off switch. So they turn the switch off. So if you want to deliver cannabinoid medicine to them, either it's CBD, THC, or any one of the other cannabinoids, your neuroreceptors are blocked. So you don't have any way to get that medicine in. And it makes a lot of sense where somebody would get really high, because now you're adding in a lot of, you're actually bypassing those neurotransmitters, and you're going directly right in, passing the blood-brain barrier and going directly as concentrated THC into your central nervous system. So we've had the same kind of effect with some of those patients. So we want to be really careful with drug interaction, especially with the opioids. The other thing is, some people, you can tell there's a gene, I think it's called D1R1 or something of that nature. I got to look it up to be exact. But anyway, that gene is associated with opioid dependency. So if you do a genetic test and you see that there's a variance in that gene, I would make the case really quickly that this person should not be on any type of opioid for pain and should move on to plant-based medicine as soon as possible, because they have the propensity to be addicted to that, which creates all kinds of other issues. So the best way is if you go to earthhealthcare.com and you sign up for a doctor consultation. Once you sign up for a doctor consultation, doctor will see you really quickly, and they can then recommend cannabis as a medicine. So it's integrative medicine. So they'll talk to you about not just cannabis, cannabis with acupuncture, with yoga, with meditation, with massage, integrative medicine that combines everything. It's a whole mind body healing. And then we set up an appointment with me. And based on the doctor recommendation, doctor notes, all HIPAA compliant, uh, I would then go through and make some recommendations on products that either exist in the marketplace now that I'm already familiar with, or we'll say we'll make a custom formulation for you fairly quickly within a week. Based on the results that we're going to get from the genetics test, now we're going to modify that formulation if need be. It may not. But if we need be, we'll modify that formulation, titrate accordingly, and they come back and see the doctor on a regular basis and report back. So it's a fairly quick process. We've come such a long way, and to be able to freely talk about plant medicine, cannabis, on a a global platform, it's satisfying. However, there's still a long way to go. We have to utilize and get together and really try to change the perception of not only our government, but also the people, like my parents' age and other people that actually didn't see this because they were brainwashed for so many years to think this is a drug and this is this and this is that, and it's not. But maybe in the near future we'll start looking at this as a primary source of their medicine, not just as a last ditch effort, an alternative. And the only way we're going to do that is through education. Thank you.